Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to talk about, can you have arthritis without pain? And the answer very simply is yes. Yes, you can. Unfortunately, most of us after the age of 18, if you just started to x-ray our joints, would notice some arthritic changes. Doesn't mean it's full-blown arthritis, doesn't mean that you feel any pain, but you're going to start to notice some changes in the joint. You've been using your knees for 18 years. You've been using your joints for 18 years. It's going to start to show some changes as that repetitive motion comes into effect. So it's, when I say you can have that arthritis component without pain, this is really important also because a lot of times when people go to the doctor and they say, hey, my knee is hurting me, doctor will take an x-ray and be like, oh, it's arthritis. Well, that's not necessarily true because you probably had arthritis in that knee before it started to hurt. So I think that a lot of times there is a diagnosis of arthritis when that doesn't even, is not even causing the pain. It's just an easy thing that shows up on an x-ray and you can say, hey, this is arthritis, but it has nothing to do with why you're having pain. So you do want to be careful of that because it's a very easy diagnosis to make because you just put an x-ray on the screen, you see some changes, therefore it's the joint is becoming arthritic or you have arthritis, and that is an easy way to say, oh, well, you can't really get pain-free because now you have arthritis, when in reality, a lot of times the pain that you're having, whether it be in your knee, your back, your hip, is not due to arthritis. It's actually due to other factors that are involved that are easily fixable. So we see a lot of times people ignore pain, ignore dealing with pain because when they go to the doctor says, yeah, you have knee pain or you have hip pain because there's arthritis, but in all reality, that has nothing to do with why you have pain. You have pain because there may be an IT band issue or there may be some muscle issue going on or some ligament or something like that. So it is, be very careful when you get and accept that diagnosis of arthritis. Most of us over the age of 18 are going to have arthritis. So it's not a scary word. It's not something that you should be horrified by. It's something that happens naturally in our bodies. But is it truly the reason that you have pain? Because there are many times that you can have arthritis and degenerative changes on an x-ray and have no pain. So make sure you get to the root cause of pain. If they're talking about doing a joint replacement because you are bone on bone, that's pain due to arthritis. That's not going to do nothing's going to help. You need to have that joint replacement. If they're not talking joint replacement, that means there's more factors at play. That means there's more that's going on that you need to address. And that arthritis diagnosis that you have is just something that was easy to point out on an x-ray and not the full picture of exactly what's going on. If you or someone you know suffering with pain and has gotten a diagnosis of arthritis and wants a little bit more in-depth information, all you have to do is call our office at 215-997-9898 and we'd be happy to give you a free consultation. Thanks and have a good day.